There's another video from Euclid Chiropractic Clinic in Upland. I'm Dr. Tony Rakovic. What I want to talk about today is Francisco's story. Okay, he came in with severe back pain, basically 8 out of 10, and his pain level went from there to 2 out of 10 over a period of a couple months, which is pretty extraordinary. With his biggest issue was his X-ray. He was a roughneck, which is an oil rigger, equipment worker in New Mexico since he was 19 years old. Because of that, his back the last basically 10 years has been beaten up and physically beaten up. What we saw with him initially is that he can barely get out of bed on his own. Over a period of that 2-month period, his x-rays changed dramatically. Because of that, it was diagnosed properly. His x-rays, you'll see the results, actually improved well. And because of that, we're going to go over his x-rays first, what a normal is, and why it's normal, so you understand as a patient what's going on. At that point, his x-rays from his pre-x-rays and his post-x-ray. So again, our goal with chiropractic is to make sure we correct the x-rays, again, drug-free treatment and also natural care without surgery, so your body heals properly. Here's our normal low back x-ray. And 3 things we look for on the x-ray is the curve of the spine, where it comes backwards. This is the front, this is the back. And when it curves backwards, it should form a nice smooth curve, meaning that each bone should connect above and below. That congruency all the way through. There. And also beyond the curve is a normal disc space between the vertebrae. There's a soft tissue in there that acts like more of a washer to cause normal motion and more for load too. When those spaces are normal, they should look symmetrical all the way through, top and bottom. Should all be like the same height from top to bottom, top to bottom, top to bottom. Those 3 things allow that nerve where it comes through here, that nice opening, that nice hole, to stay nice and big. The spine comes forward at all, where you lose straight, where it becomes very straight. At that point, over time, you can compress the disc to make those areas a lot smaller, where the nerve there, that opening, that foramina, will start closing off. Our job with chiropractic is keep those spaces open, causing these bones back here to move. That normal motion, the bones back there, allow these spaces to maintain the normal curve, and also maintain normal spacing. Here, the disc, at that point, that opening stays nice and big. Realize that disc is a living tissue. It can heal, but it needs time to heal so it goes back to better normal if it has been thinned out over time. As you can see in Francisco's first x-ray, is that these bones, instead of being separated, came close together where it pinched on that side, causing that disc to thin. Pinched there along with a step defect moving forward. And also here too, where it pinched really far over, causing it to pinch and shrink that disc. So his spacings back here were very small. That opening canal, the nerve comes through, causing a lot of back pain and also some leg pain where he couldn't be able to work. Here's Francisco's second x-ray only a couple months later of consistent frequent care, to where because we're moving the bones again back here in the spine, we're causing each joint to move normally. So now these joints are coming closer together, more of a nice smooth curve. And now the disc spacing between the vertebrae is opening up also. We're seeing those spaces open to get more of a normal looking spine because of normal motion in the spine we're causing that same time. So I hope you see that our goal with our patients is to make sure they understand their x-rays, because that's how we diagnose and figure out how we can treat someone for their back pain, neck pain, or whatever is going on. Our goal is structurally correct the spine, maybe the low back here or the neck over there, is so overall the body can heal properly from a muscle perspective, from a joint perspective, from a nerve perspective. All right? Any questions, call our office. Have a great day.